Hello, my name is Dr. Magna Parks, and I'm a licensed psychologist. My husband and I have an organization called Be in Good Health, where we teach people principles that can help them with their physical, mental, and spiritual health. Today we'll be talking about treating depression naturally. You know, I've been a psychologist for over 20 years, and what I'm going to share with you today is not what I learned in school. For about 18 years I used the traditional method for helping people with their emotional disorders, but about 2 or 3 years ago I was blessed with the opportunity to learn more about how depression can be treated naturally and even more effectively, and I'm going to be sharing some of those principles with you today. Let's look at some information about depression. Depression is increasing. The number of people developing depression worldwide has steadily increased since 1915. So if you were to put this on a chart, you would see depression just slowly increasing since 1915. And you know, that's kind of surprising when you consider the fact that we have much more fun things to do in society today. You would think that depression would be decreasing. But as we go on with this talk, you'll see why that is not the case. If you look at when major episodes of depression are occurring, we see that it occurs frequently by age 15, but there are even some situations where major depression is diagnosed even younger than that. Let's look at some statistics to help us get a better picture of depression. It affects approximately 18.8 million Americans ages 18 and older in a given year. That's a lot of people in 1 year. It affects at least 350 million people worldwide. And keep in mind, these statistics are at least 3 or 4 years old, so I'm sure the number may be a little higher today. Everyone, let me repeat, everyone will at some time in their life be affected by depression, either their own or someone else's. So you will be affected by depression. Depression will be the second largest killer after heart disease by 2020. So this kind of makes me stand up and say this is something we cannot ignore. Some more information about depression. Most people who suffer from depression are never diagnosed with the condition. So those numbers that we gave earlier does not reflect what most people are suffering from because they're not diagnosed. And the reason for this is here's one. 41% of depressed women are too embarrassed to seek help. 54% of people believe depression is a personal weakness. So they may say things to you like, oh, just get over it, or just cheer up, or, you know, think positive. And some of that might be true, but depression is a real disorder and it's not a weakness. Most people with a depressive disorder, because of how people look at it, because of the fact that they're ashamed, do not seek treatment. So it's a real issue. So what is depression? Most of us feel down sometimes. Sometimes you just feel like the blahs, having the blues, or just blah. But depression is a little more than that. So let's look at some of the symptoms of depression. First of all, anyone who has a persistent, sad, anxious, or empty mood, and notice the word is persistent, meaning it lasts for a while. Another symptom is that you have a loss of interest or pleasure. You may have enjoyed gardening, you may have enjoyed cooking, sewing, but suddenly you find yourself not interested in that anymore, or it doesn't bring pleasure when you engage in those activities. Difficulty concentrating or making decisions, another symptom of depression. Appetite and or weight loss, or overeating and or weight gain. So you could either be losing weight, gaining weight, losing appetite, or eating too much. All of these can suggest that you're suffering from depression. Other symptoms, not getting enough sleep or poor sleep, or having too much sleep. Another symptom is increased agitation. You're more easily irritated, you're more easily frustrated, or increased slowness. And the interesting thing about the slowness is that usually you won't notice it. Other people will say, you know, you're kind of slowing down and not moving as fast. What's wrong? Decreased energy. You know, this is one of the major reasons people will go to their medical doctors. They'll say, Doc, I've just been feeling tired. So I've just been feeling fatigued and tired, and I don't know why. And many times, not always, but many times it's because they're suffering from depression. Feelings of worthlessness or excessive guilt, feeling that you're not worth anything. Why am I in this world? Or guilty about things that you might not need to feel guilty about, or feeling too much guilt. And finally, thoughts of death or suicide, and even past suicide attempts. Now, I want to caution you, just because you have 1 or 2 of these symptoms doesn't mean you're depressed. What we say is that if you have at least 4 or 5 of them within the last 2 weeks, then we'll diagnose you as clinicians with something known as major depression. If you're experiencing less than those symptoms, there are other types of depression that we would give you as a label. Another additional symptom that's not included in that list that I just went over is if you're having chronic physical symptoms that do not respond to treatment. I remember people coming into me referred by their medical doctors who would have headaches, who would have stomach aches or back aches, and it's not responding to any of their medical treatments, and a lot of times they had a hunch that it might have been depression, and that could have been the case. Depression also affects the body, and there's some serious ramifications that can come. Let's look at it. It increases the risk of stroke. It increases the risk of heart disease in men. I'm not exactly sure why it's not saying women, but we're just looking at the research, and it shows it increases the risk of heart disease in men. It increases the risk of death from cancer. It also increases the risk of death from pneumonia. And finally, depression increases the risk of suicide. The more you are depressed, the more likely you will kill yourself. So depression is something we cannot ignore. It's pretty serious. When you look at this connection to some of these physical illnesses, it kind of makes you stand up and take notice of it. Now, there are some standard treatments. These are some of the things I was taught. First of all, prescription medication. Typically, when a person goes to their medical doctor and they diagnose them with depression, they'll give them Prozac or Zoloft or Paxil, you know, some of the more common antidepressants, and sometimes they can relieve symptoms. The problem with these antidepressants, right now we don't know what the long-term results are, and I do know some of you remember hearing about the black box warnings that they place on them because it increases the risk of suicide, especially for adolescents, some of these medications. And then some of them don't work. Some people still report problems using medications for depression. So it's not the best answer, even though it can be helpful. And this is what I was specifically taught. The second standard treatment is talk therapy. Usually when doctors couldn't do anything with their patients who were depressed, I would get them and say, you know, do some talk therapy, see if this will help their depression. And talk therapy is nice, it makes you feel better, but it doesn't really get at the root of the problem. And the other thing is that it doesn't help people to learn how to cope. Sometimes you can develop a dependent relationship with that therapist and you're not really resolving your problems. One of the major causes of depression is a dysfunction of the brain, and the medicine is supposed to help with that, but it doesn't help as much as it should. And talk therapy, just talking to someone, is not going to help your brain function better. So we need to look at things that's going to help the brain function better if we want to help with depression. The curse causeless shall not come. Proverbs 26:2. When you look into the Bible, this verse tells us that without a cause, you will not have a curse. Okay? And so we need to understand some of the causes of depression. And in a book that I have called Pathways, it talks about this a little bit more, where she says to us, written by an inspired writer, she says on page 37, disease never comes without a cause. Disease never comes without a cause. So if that's the case, we need to understand that if it doesn't come without a cause, we need to know what the cause is. And that's what we're going to look at today. Nutrition and depression. It cannot be too often repeated that whatever is taken into the stomach affects not only the body, but ultimately the mind as well. This, again, is reading by the same author of this book, Pathways. And she wrote this over 100 years ago. We believe she was inspired as to how she was able to understand this. Right now, we see that the body and mind are connected, but back then when she wrote this, we didn't recognize that what we eat can affect our mind as well. So let's look at some of the major nutritional causes of depression. We're going to use some big words here, but we will break them down as we go on. One of the major nutritional causes of depression is insufficient dietary tryptophan, and tryptophan is an amino acid. We're going to talk about that. Low omega-3 fatty acid intake, another major nutritional cause of depression. Low folate levels. We're going to talk about each one of these. And finally, poor carbohydrate intake. All of these are some of the major causes of depression nutritionally.